Hi, welcome back to Whiteboard Wednesdays. This is Dr. Inkyong Parrack from Sarasota Vascular Specialists. Today, here to talk about prevention and treatment in vascular surgery. Prevention, what does this mean for you? So there's actually, in most instances, no warning about the plaque. How does a heart attack happen? How does a stroke happen? It's a sudden event. So you will never know as you walk day to day if something could happen unless you go checked on it. Two things that we do in preventative care is stroke prevention and aneurysm rupture prevention. So when patients come in and they are found to have more than 80% carotid artery disease, then their risk of stroke in the next 3 to 5 years, we usually quote between 12 to 15%. This is not small. That means within any time within the given year, you have about 3 to 5% risk of stroke. When people talk about stroke, what is very difficult to deal with is that it is severely debilitating from your lack of ability to talk, lack of ability to see, or lack of ability to move from the sequelae or the consequences of the stroke. And it is not that you are just letting go. A lot of people think that once you have a stroke, you can just say, okay, I'm just going to pull the plug and let go. That is not usually possible. And you're just left with an incredibly devastating outcomes. Now let's talk about the treatment side. So the treatment side is when you come in saying there's something wrong with me. And a lot of times it's usually legs. So people come in with lower extremity pain or ulcers or wounds, and I have a whole different series as we had talked about on this. That is something that we can treat to make you better. So the treatment side is pretty simple in some ways because you come in, you know there's something wrong, you know there's something not quite right. And if this is due to circulation issues that can be fixed and the risks of fixing it is not that great so that you benefit a lot from it, then we're going to help you and we're going to recommend that you get a surgery or endovascular, meaning minimally invasive surgery with us in order to get the problem addressed. So in summary, vascular surgery encompasses both preventative side as well as the treatment side. And the preventative side can be just as scary, and it requires sometimes a pretty major surgical fix to prevent devastating outcomes from happening. So this is Dr. Inkyong Parrack with Sarasota Vascular Specialists. Let's talk about some more interesting vascular issues next time.